ao nosso palestrante. So from now on, I'm going to start speaking in English. Well, good morning, everyone. It's a great honor to have you all here today for this special meeting. We are delighted to have the participation of this highly qualified audience with professors from different dental schools all over Brazil. As the current president of the group of professors of endodontology of Rio Grande do Sul, GPERGS, I wish to introduce and thank the valuable participation of our speaker, Professor Livio Steyer, from the Department of Preventive and Restorative Sciences of the University of Pennsylvania. Professor Livio, thank you very much for dedicating your time to be with us. Dr. Steyer will be lecturing about the reveal, a new concept for the theragnosis. I also wish to thank the participation and contribution of our experienced mediators, Professor Marco Antonio Ungaro Duarte, head of the Department of Restorative Dentistry and Endodontics and Dental Materials of the Dental School of the University of São Paulo, Bauru, and also the current president of the Brazilian Society of Endodontology, SBEndo, and our other mediator, Professor José Antônio Poli de Figueiredo, head of oral biology at the Federal University of Rio Grande do Sul. I also wish to thank and introduce Optima as the organizer of this meeting and as the Designs for Vision representative in Brazil. Thank you, Mr. Elio, Mrs. Maria Paula, Mrs. Kate, and all the staff. The support and partnership of these companies are highly knowledgeable. Professor Livio, feel free to start your lecture, and we look forward to have you in Porto Alegre in the 3rd International Congress of Endodontology on April 2021. Thank you.
Thank you, everyone. A very good morning. I am delighted and honored to have been invited to discuss this new concept with you today. If it will be too much science, please let me know. We can always jump over. Let me first start sharing sharing my screen. Oh, that's not good. That's not the right one. Slideshow. What happened now? Sorry. Okay. So it is all about a new concept. Basically, the concept is not new. Fluorescence is nothing new here. Only it has been overseen for a very, very long period of time. So first of all, allow me please a disclaimer, because this technology reveal, I hold IP rights with the technology, and yes, I will touch royalties on the product. So what is the road trip of this presentation? The road trip, surely we have to discuss bioluminescence, because fluorescence is one of the subcategories of bioluminescence. We have to discuss and define the term theragnosis. We will briefly look into theragnosis, into the concept of fluorescence enhanced theragnosis in cardiology, periodontology, perimplantology. We may have to understand and to look up for ideas like and knowledge, additional knowledge based on the so-called Maillard reaction. Maybe we'll have to understand a little bit more about porphyrins, exogenous fluorophores as well. And we shall see how far we come. And if I do not manage, yes, the topic is very, very wide. and we are developing more and more and more on that. So yes, it is just a teaser for everyone. So bioluminescence. Bioluminescence, clearly you see it here. Quinine in tonic water under daylight and under fluorescence. Clearly sees a difference. This is what fluorescence is. So meaning you come now with a light source, and at a certain wavelength you excite something, and then you come back having a filter here, and then you have the observation, and from here you get your information. Fluorescence is defined, of course, as the light emitted by an atom, okay, following, of course, a finite duration of excitation, light excitation. The absorption is quite short, and this will then bring the atom and or the molecule into a different state for a very short period of time. Upon excitation, then we have this fluorescent molecule. But we have to understand from the beginning that this excited molecule will return back to its initial state, okay? So it is all about energy. And this is the very famous, I cannot not mention that. It is the very famous Jablonski diagram illustrating the ground state, then the excitation using the photons of the molecules, and then from here the molecule will be excited for a short period of time, but it will give up its additional energy, and it will come back into the initial state. What is very interesting about that is that fluorescence can provide information about the presence and distribution of specific molecules. Is it okay for the translation, please? Good. These molecules are called fluorophores. And yes, this is exactly what we are looking for. We are looking for to identify those specific, those very specific molecules. So compared to bioluminescence or chemiluminescence technique, the benefit of using fluorescence is that a single fluorophore can be excited multiple times. So it's not like just the effect is one-time effect. It is an effect which we can repeat. So it clearly serves us very well to identify and see what we cannot see by daylight and simply using visual effect. Fluorescence methods are easier to manage than others, and of course we do not have here radioactivity, so it is a completely non-invasive technology, neither for the patient, the one whom we care about, neither for the clinician and the staff. So, you know, probably the most interesting and where fluorescence really lives up to its abilities today is, of course, cancer, early cancer detection, tumor margin detection, and more, photobiomodulation, and so on and so on. The prospect of using autofluorescence to provide label-free readouts of molecular changes, okay? So early manifestation of disease. And sorry, who other than the dental clinician, our students, our graduates, should be #1 involved in everyday work to identify and to early detect oral tumor. 700,000 cases, new cases each year, mortality 50%, costs and quality of life. Let's not talk about it because we all know it. So the actual autofluorescence signal excited in biological tissue will of course be dependent on the presence of fluorescence and of course chromophores, especially those chromophores with a hemoglobin background. So basically autofluorescence signals therefore reflect the biochemical and structural composition of the tissue. So we understand now the tissue, okay? The autofluorescence, so while autofluorescence can be of course measured and so on, there is no discussion about that. Autofluorescent intensity signal may be of course affected by several other criteria. Among those is of course the concentration, the excitation, the angle of the excitation, and so on and so on. So you understand when we started being interested in building this new technology, the engineers had to be very careful and research everything, the entire background to understand and to explain and to build the technology. So natural tissue autofluorescence originates primarily from specific endogenous fluorophores. So we have two. We have endogenous and we have exogenous fluorophores. If we discuss, and we maybe just briefly discuss photoactivated disinfection, there you use exogenous fluorophores. But for the diagnosis here, we use the endogenous fluorophores, mostly in this area, the porphyrins. So we'll have to understand, number one, that we have, it is not simply about building a loop, having a fluorescence light. It is about understanding the excitation wavelengths, which is determined by the molecules which we want to excite. And then you have also to clearly understand the emission wavelengths. And there is a need to differentiate, because this is why the reveal has very special coatings built in, which works together with the excitation light and with the fluorophores which we want to identify. So mostly so the most distinguished members of the porphyrin family are, of course, chlorophylls. Then we have heme, and it was good to understand that porphyrins are the dominant autofluorescing substances, and yes, their fluorescence will be in the red spectral region. So when using this kind of fluorescence technology with this certain emission and excitation filtered wavelengths, then we have this red fluorescence, red-orange fluorescence, which is decisive for our information. And yes, as you clearly can see, it is also very well used to detect oral squamous cell carcinoma. Here, at the beginning, we may not see that fluorescence. We may only see the destruction in the collagen, which will clearly then hide a lot of that fluorescence. But if we use fluorophores like 5-ALA, then suddenly we can detect, we have the full picture in front of us. So just as a reminder, the biosynthesis of heme, and you clearly can see Here is this so-called 5-aminolevulinic acid, which is indeed a precursor of protoporphyrin 9, which in combination with the HEM will generate the autofluorescence of those porphyrins which we are looking for in dentistry at this stage. So porphyrins, they cause both red and green, or they are present in both in green and in red. In red, due to the HEM, to the blood, and in green in the plants due to the chlorophyll, as already explained. We will find porphyrins in plants, in animals. We also have other kinds of porphyrins. As I said, it is very important to understand the importance of HEM, because the presence of HEM, because only in the presence of HEM we will have this red light, this red emission of the which we want to identify. Porphyrins at the same time are very highly interactive. And this is what is very, very important to be understood, because they can disrupt as well the cell membrane, and because they hold an iron molecule with the potential to act as an electron sink, they encourage the formation of free radicals. What does this hint to? This clearly hints to the ability of use of porphyrins or application of porphyrins for destruction for the destruction of membranes, meaning disinfection. And here we go. I don't think we have the time to dedicate this very short introduction to this topic, but I can simply assure you that photoactivated disinfection is a major and of highest importance topic in the future. And once again, congratulations to Marco for your wonderful recent paper, which I had the pleasure of reading yesterday. Mechanism of porphyrin photosensitization. It is really the presence of the porphyrin in the bacteria. We can use photoexcitation to generate this reactive oxygen species, those oxygen singlets, which are very active. The problem is the excitation state is very, very short. It's around less or around 1 microsecond before it falls back. So we have different types of reaction. With this photoactivated disinfection, we have reaction type 1, which generates the cytotoxic reactive oxygen species, such as superoxide or hydrogen peroxide, and of course hydroxyl radicals. And then we have the reaction, the type 2 reaction. This triplet state then of the photosensitizer can then transmit its energy directly to triplet ground state molecular oxygen found in most cells to form this excited state of singlet oxygen. And I do not have to explain you the successful cytotoxic effect of reactive oxygen species and its lethal effects. So, as I said, porphyrins are most widely used today in photoactivated disinfection. In photoactivated disinfection, once again, the two-type reaction. So you have the ground state. This basically is nothing else than the Jablonski diagram. And then you have the two different reactions of the excited photosensitizers, the type 1 reaction and the type 2 reaction, the type 1 generating the free radicals, and the type 2 reaction, of course, generating the singlet oxygen, which is able to lead to this bacterial cell death. Yes, we have porphyrins in plants, the chlorophyll, as already explained. They capture the light from the sunlight and so on, but this really is not our topics. Then we have the porphyrins in the bacteria. And here we have to understand that we need, or we are in need of the hem to have that red light of the porphyrins. So determination, this is a very, very interesting study, because this study was the first study and the only one, to my knowledge, that managed to clearly prove and determine the presence of porphyrins in P. gingivalis and Actinomycetum comitans. We both know this is among the most aggressive perioactive bacteria ever. So obligate anaerobic bacteria are the ones who are responsible for the red fluorescence because of their increasing number in the mature oral biofilm. And we will shortly immediately discuss the biofilm and what it means to have a mature or a fresh biofilm. Fresh biofilm is not really, does not really contain at that stage porphyrins. So meaning using fluorescence to detect fresh biofilm will not be possible without the support of external fluorophores. The moment where a biofilm, there is around a period of time of around 7 to 10 days for this maturation process of biofilm. And the moment where Fusobacterium nucleatum joins the game, then we start having, then everything is changing, and at that stage we start having P. gingivalis and so on, which then we will be able to detect and classify as a mature biofilm. So the fresh biofilm has still a green fluorescence in the mouse. The mature biofilm, once having adhesively joined the nucleatum, then it will turn and we'll have the red fluorescence. Several studies which demonstrated that, and you clearly see the difference. Using daylight, so white light is one thing, but using fluorescence, it's a completely game changer. You are in a different new position. You are entitled, you are able to start diagnosis. So allow me please to say this. I am now looking back onto 37 years of dentistry. What have I done for the last 37 years? And I feel ashamed. I feel ashamed towards my students. I feel ashamed towards my patients, because this kind of technology is not new. But all we do every day is looking forward into how we can develop new materials instead of really looking up into how we can improve diagnosis with simple methodology. Sorry, but yes, you understand my frustration. So you clearly see now how beautifully you can see in the fluorescence, the mature fluorescence. This has been very nicely shown in Dr. Folgenak's PhD study, at ACTA in Netherlands. So red and green autofluorescence are frequently observed from dental plaque and calculus after excitation by UV and blue light. So you know we have to divide the UV and UVA, BC. Yes, there is a harm with different wavelengths also for the eyesight, patient and clinician. Yes, Designs for Vision has really cared about this, and you will be surprised once you hold it in your hands and you see the data and everything, how safe this technology is for all involved in using the technology. So again, green fluorescence results from riboflavin derivatives and is more commonly associated with early biofilms, while the red fluorescence is with mature periodontopathic biofilm and is associated with porphyrins. You remember 5-ALA, and I showed you it is a precursor of protoporphyrin 9, and so on and so on. Another very interesting topic is, of course, bioluminescence and calcium ions. Why? Because you know that the hard tissue, or the tooth hard tissue, the calcium ions, the demineralization process, and so on. And we have to finally get understanding for the idea of demineralization, arrested decay or not active decay, and active decay meaning an area which is contaminated by caries active bacteria. So to understand this, one could use so-called photoporphyrins. Photoporphyrins are biologically present. So it is nothing which deserves any FDA or other approval, because it is present in the water. It is a product of luciferin, and these photoproteins can be very nicely identify calcium ions. And like this, we can very nicely detect, let me go one slide further, very nicely can, if applied on the tooth in areas of demineralization, one clearly can identify the area of demineralization. And clearly, if we intend to have a remineralization, then we again apply photoaquarine or photoproteins to clearly identify the process of remineralization. Yes, you can use it this way, a technology coming from the UK. It is called Calcivis. It complements basically the idea of reveal. Here you clearly can see from the website of Calcivis their images using photoporphyrins to identify demineralization areas. I do think that this is, in my personal opinion, this is more an educative and a more research indication. I would prefer, for my students, for my graduates, for my patients, I would prefer to understand the level of contamination. And yes, demineralization I can see also with simple application of fluorophores without the need of photoproteins. Something very, very important to understand, gentlemen, especially not only for perio reasons, but also for endo reasons, is the so-called Maillard reaction. The Maillard reaction is the reaction between amino compound and carbonyl compound, okay? So meaning the reaction of sugar, okay? There is a certain level of fluorescence which is developed during the immediate stage of the Maillard reaction. It is a collagen cross-linking, yes? So meaning, let me jump, if you consider those brownish dentin, okay, in a decay, when you look up and you do not identify the presence of porphyrin, that is this cross-linked collagen. Does it mean that we have to remove it? And this is clearly an issue which we at UPenn, I am proud to say that the dean and also Professor Markus Blatz and the dean, Professor Mark Wolf, both agree and back me up on that, that we do not have to entirely remove that brownish area, all still containing minerals, okay? And this is, I know we are all endodontists, but I guess we agree all that the best root canal treatment is the one which we do not have to perform. So I would prefer to expand endodontics into endodontology and give here a new value and build up and construct a new idea in how to preserve vitality also in advanced cases, which clearly today would deserve and will be categorized for a root canal treatment. So glycation and oxidative stress also is a very important topic in dental implantology. There clearly is, as you clearly can see, peri-implantitis is a multifactorial disease in which glycation and oxidative stress plays a role in terms of etiology and severity. So clearly understand the importance of knowledge and of understanding of the Maillard reaction. So yes, the endoperio case is also of high interest for us endodontists because again we have these advanced glycation end products which play an important role. Advanced glycation end products influence the progression and severity of periodontitis that clinically manifests by slow loss of soft and hard supporting tissue. So being able to use fluorescence to detect perioactive bacteria and the fluorescence of advanced glycation end product puts us in a different diagnostic opportunity. And this is what we have to understand and to appreciate about all this. Now let's go, how are doing time-wise? Okay. So let's go now to understand what the term theragnosis means. You know, theragnosis, as I said till today, I felt like going to a hunt and in dark and not seeing anything, even using a microscope, but being very sure that I am the best hunter ever. So now starting to use this night vision technology, we enter into a different position. And yes, we start this problem of sensitivity versus specificity. We are now managing to address from a different perspective. What is fluorescence enhanced theragnosis? So theragnostic is a treatment strategy that combines therapeutics with diagnostics. Why? Because, ladies and gentlemen, we do not only now use the fluorescence technology for diagnosis, no, we continue to use it also for the therapy, meaning it guides us to understand the moment and to evaluate the moment where our therapy has come to an end, meaning disinfection or removal of biofilm has been accomplished. Why? Fluorescence disappears. So it is not only a diagnostic procedure, it is also a therapy guidance procedure. Okay, for the first time, we are changing our understanding and our abilities. In medicine, it is not new. In medicine, yes, this is probably why physicians do not really evaluate dentists at their real value. Fluorescence imaging, fluorescence guided imaging in surgery is the way to go. Imagine all those tumors where in early days, the surgeon was simply removing the tumor according to his daylight vision, sending into to pathology and awaiting for 2 to 4 weeks for the results. And then either the surgery was successful or the patient has to undergo a second surgery or too much tissue removed. Now, using fluorescence and fluorophores, you do a straight shooting, okay? So it's a different situation. And as I always say, please imagine and be grateful for the opportunity to be allowed to help humankind. So this is the attitude we may have to change. Yes, technologies are already available, as you clearly can see. They start in combination with microscopes and so on in hospitals for fluorescence-guided surgery. These technologies start at around 250K and go up to 500K. I simply ask you, can every humankind allow himself to go and to pay a clinician who has, or a hospital who has this technology available? I would clearly answer you, no. And this is why we came up designs. I'm very grateful to Designs for Vision for having listened to my idea and went to practice and to build this technology, which is basically a special magnification. We clearly have here very clearly determined coatings. We have coatings here, and we have this fluorescent light, and this is an assembly which works very nicely. You also do not need an additional, you see how many hands are dealing here? You do not need all these hands because you have everything on your carried on your nose. Of course, the bigger the nose, the easier to carry. So the application in dentistry now, yes, it is quite easy to use it, as you clearly can see. So it opens different doors. As I said, fluorescence enhanced theragnosis will be used, fluorescence will be used either the endogenous or the exogenous fluorescence, meaning you can use either the endogenous fluorophores in the bacteria, or you will, for mature biofilm, or you use exogenous fluorophores. The technology serves for diagnosis, treatment, guidance, and of course also outcome evaluation. And it can also serve for documentation purposes, both for forensic purposes as well as patient education. In my clinics, I usually, so the patient, you have to understand, the patient receives a protection glass, okay? And I usually give my patient always a mirror in his hand, and I call it weapon equality. So we both can at the same time see the very same picture, leading to a better decision making, to a motivation, to change the attitude and to raise the medical IQ of the patient. Decision-making protocols are different, and so on and so on. So this was the diagnosis. Of course, as I already mentioned, yes, it is currently an off-label my statement and everything in regards to cancer detection is for the moment not claimed by Designs for Vision. It is an off-label claim performed by myself based on scientific evidence. Okay, good. So currently the burden of oral cancer is very high. The costs, the life expectancy, and so on, as we clearly discussed this morning, Fig. I'm very glad to also I'm sure you all are familiar with the research Professor Figueiredo and Professor Geraldo Hotz in Porto Alegre have already initiated. In addition, there is a research undergoing at the University of Belgrade by Dr. Vladan Kekovic, and in combination with the University of Vienna. So also this is on its way. The benefits, I guess we can jump over it. You as clinicians clearly understand this, and I do not have to really explain and demonstrate the scientific background on that. Next topic is surely caries. Caries, because we understood that caries, or we clearly know that caries is bacterial, has this bacterial contamination involvement. In many books, a lot of publications here, gentlemen, you clearly can see now the picture. This is daylight, and this is now fluorescence application using the reveal technology, and you clearly can see the difference. In classic days, or still today, following the concept, the black concept, we would remove everything until we have a clear need and so-called healthy tissue. But we will also, the damage we will cause is quite high. So using fluorescence, we clearly can identify the areas which are contaminated, and we can generate, using the current and modern bioactive materials, we can happily use minimal invasive approaches, and the quantity of remaining tissue in the direction of the pulp is much higher than before, and we can generate tertiary dentin. Clearly, you can clearly see this is the daylight picture, and here, ladies and gentlemen, you clearly see now the infected area. Only areas to be addressed are these ones. So this brown area, as already explained, this brown area is what I explained. You remember the collagen cross-linking, the brownish discoloration generated by the advanced glycation end products due to the Maillard reaction. So clearly, fluorescence empowers objective valuation. It influences treatment selection. It empowers minimal intervention dentistry. It enhances treatment guidance. It changes the picture of diagnosis. It is all a matter of what this concept involves. So clearly, what I want you to understand is, by starting the use and introducing this so-called fluorescence enhanced theragnosis, we are introducing and changing the concept of dentistry. Okay, we are now jumping into the 21st century. So yes, we discussed this already. You clearly can see. Yes, you see here the brownish area. I have explained it already to you, and I'm sure you will agree with me that the concept of drill and fill belongs to the past, and in the future minimal intervention, prevention is the way to go. And you now clearly have the weapons in your hand to educate and to perform this new approach. So reveal will be used in both in dentistry and in dental hygiene. The dental hygienist will highly benefit out of that. Let's see how. We still teach and we still explain the tactile, so using the probe and so on for the detection of calculus and so on and so on. Today you understand and you will clearly immediately see the difference. The limitations of visual tactile lesion diagnosis, this includes the fact that visual tactile diagnosis requires subjective evaluation. And please, how many of our colleagues out there are really regularly going to check their eyesight, are using magnification and additional light? So this is where we have, where we as educators have to change the game and to differently address the education in dentistry. And I'm very, very impressed to tell you that in the United States, at the beginning of dental education, the student is, as part of his school starting or dental education starting, he has to purchase a magnification technology. This is something very, very good. So again, the picture, I showed you this already, and these are some clinical pictures of the clinical pictures using the fluorescence, the reveal technology. One clearly can see the only areas which you are really which you really have to address, the red orange areas, and this is really all you have to address. The brownish part in early days in the black concept we would have to remove. Today in this concept we do not remove at all. Further pictures of that, further pictures showing that, and here you clearly can again see how it looks and what you have to address and what you can leave behind and what you have to remove. Yes, also in different other concepts, in the Fisher, in the Pitt and Fisher decay, one clearly can see what he has to do. And I hope you don't start yawning yet. We still have a couple of minutes to go. I will, of course, not manage to finish all my stuff. You clearly can see here the calculus, so contaminated calculus. You clearly can see here the mature biofilm. You now clearly understand when and what you have to remove. You clearly can watch here a wonderful picture of these extracted implants, and you can see, so you may ask yourself, excuse me, why did he not use from start fluorescence to identify the contamination of all these area? He may have been able to save this very costly and high sophisticated treatment. So also in orthodontic mini implants, the very same ideas. Here you can clearly see in the mouse already an area which deserves attention. Another picture out of the clinical picture. Here a case coming, you will not really understand where to start and what to look for. So this is why, even so you are using at the beginning the reveal, you clearly see there is no red orange. What does this mean? Well, this clearly means that this is arrested decay. So the amount of tooth structure which has to be removed is almost zero. But if you apply a fluorescent dye, you will identify fresh plaque. So you will start differently with your treatment, and you will give this treatment a complete different protocol and different care. Yes, there are technologies already, similar technologies already available on the market. This is the QLF technology from ACTA from Netherlands, but it is a camera, it needs a third hand, it interrupts the treatment, it nicely complements a reveal, but it is not the way to go. This is a clear case from my good colleague and friend, Dr. Gal Hilch. He is our PhD student in Porto Alegre. And voila, the extracted implants, and you clearly can see advanced glycation and end products and radioactive bacteria. I can bring you through many other cases to see the very same picture and to understand where you are. I had the very bad experience last year of intending to demonstrate the technology to our ortho colleagues, which really had the arrogance to say that they do not need magnification or fluorescence in currently orthodontics, but you clearly can see, and it is nicely described by Roberto Justus here, the idea of demineralization around the brackets and the need of monitoring and controlling this idea. And maybe shortly for us, for the endodontists, the idea of the cracked tooth syndrome, where we really do not know with classic visual abilities, are those cracks infected, yes or no? But using today, this is a study showing that using this kind of technology, we may be able to identify and to determine infection in cracked teeth, and by this identify and give us a better choice for the treatment, for the treatment choice we would like to address and we would like to use in here. Yes, steps to reality. Here, a very clear, another very clear study showing the diagnosis and management of cracked tooth by quantitative light-induced fluorescence technology, and it clearly shows the benefits of using fluorescence when diagnosing the cracked tooth, and understanding as well the level of infection in this area. And yes, any of you interested in initiating studies in this direction, I am happy to join you to help. And of course, please always count on my support in any terms. Yes, active orange-red fluorescence of active caries has been already documented. Sadly, not really understood by the classic educators, but in combination with this is how these are my personal work many years ago, when, so you see clearly 2008, when I also followed the black concept, which I wouldn't follow today anymore, when I removed all the brown orange and dentin, brown orange dentin, and I really destroyed heavily the teeth. Yes, I did a reinforcement, but nevertheless, I would prefer today to not have to do this reinforcement. So yes, all in all, I'm sure you will love the idea, you will love the technology, you will love the way it is developing and the benefits. Different concepts have already been established and are used for treatment guidance as well. The problem, as you clearly see, a third hand is needed. The third hand is needed to keep and to hold this additional technology. This is Professor Hervé Tasserie from the University of Montpellier using a reveal. He has godfathered he's one of the godfathers of the SoproLife, not of the SoproLife technology here. And yes, phase technology is surely well known to you. As already explained, this is the difference between the green autofluorescence and the areas of contaminated with bacteria, which we clearly now can differentiate. I explained to you the involvement of pentozidines. The pentozidines, again, are the advanced glycation end products, the results of the Maillard reaction. So they work together with the porphyrins, and this is together, they give us this picture, this fluorescent picture. It is not something which can be only used in cardiology. It can be used in periodontology, in peri-implantology. As I already shown you this picture. And yes, it is very important in implantology because the heavier the destruction around a diseased implant, the more difficult the reconstruction of the area. And everyone, especially the dental hygienist, will want to understand the moment when calculus will be completely removed. So, well, this red fluorescence will disappear, and we will be able to differentiate and to understand that our treatment is completed. Clearly, pictures showing the very same. I explained that to you. At this stage, I would like to come slowly to an end. Yes, I just teased you. I just superficially touched the topic. I would very much like to invite you to attend the 3rd International Congress. Oh, it is in Porto Alegre, yes, next year. I want already to tease you and letting you know that Fig and myself, we will be dancing on the podium because Maximilian will be playing Stairways to Heaven as he promised. And I would like to invite you also to attend. I have built a very nice Facebook site, educational purpose, okay? Only facts. This is this bioluminescence in healthcare, and you are kindly invited to join. And I would like to, first of all, thank you for having invited me, for having giving me this opportunity to share this with you, your time. I would like to thank Designs for Vision for having listened to me. And once again, thank you very much. And I came to an end. Thank you.
Thank you so much, Dr. Levi-Steyr, for your wonderful lecture. And following the protocol from now on, we have Professor Figueiredo and Professor Marco Ungaro Duarte to manage the questions. And please, everyone, every professors who are here today, feel free to raise questions. We are here to discuss the topic.
Dr. Levy, congratulations by the spectacular lecture. It was very good. And there is a question. Is there clinical studies evaluating the accuracy, sensibility, specificity, and the predictive negatives and positive values of fluorescence in the detection of caries, endodontic biofilm and buccal cancer?
The clear answer in so far is no.
No.
But with your support and help, we can change this.
Okay.
Great, great, great. Is there some planning for carrying out some clinical diagnostic studies on these topics?
I have one resident. I may have the next resident already at UPenn. And we are there is a difference of performing research in the US compared to research performed in my beloved place, Brazil. When you come up with a proposal here, the first question is we have to find funding. And all this is one of the problem, and also the question, like Professor Ungaro Duarte has formulated. This is a question which I clearly have some difficulties with the question per se. We are here dealing with dentistry. We are not dealing with chemotherapeutica. To use chemotherapeutica, yes, the formulation of the question as you have done is adequate. In my opinion, please don't take me wrong, this is now only an academic discussion, yes? If I clearly see, I understand the scientific background, okay, then I allow myself to work and to use it at a different level than I would use a new chemotherapy for cancer patients. And also in these situations, the criteria will never be sufficient to answer a formulated questions due to other involved factors and criteria. But as I said, I have just initiated a master, so it's a master thesis with one of our residents at UPenn. And I am happy if you come up with ideas, with research proposals. I am happy. Yes, I want to dedicate, this is my dedication for the future. I want to help and make a change.
Thank you.
Livio, I believe there is there are some studies on oral cancer when fluorophores are used.
Yes.
And
Yes.
apparently specificity and sensitivity are about 95%.
But
and
this is oral, this is in cancer.
Yes. The question included oral cancer. That's why I wanted to raise.
Okay, sorry. Okay, sorry.
And that's why I'm asking you, since this was achieved using fluorophores, what is your thought about using specific fluorophores for endodontology?
Okay, my view of using the technology in odontology is number one, twofold. Okay, sorry, my grandson is now here. Sorry for that. My application and use, please. So my application and indication of using this technology in endodontics is twofold. Number one, I would love to use it in diagnosis, as we correctly discussed. Number two, I would like to use it in photoactivated disinfection. Number three, you're silent. And number 3 will be to use the dead life assays. I have a problem. You know, we believe that we know exactly when we managed to get the root canal disinfected. Do we really know that? No. So yes, Foschi et al. Have published this paper where they used calcivis. So basically, it's quite simple. We can use dead life assays, which are already available on the market. We use dead life assays, meaning we finish the chemical disinfection protocol, we take a paper point, we dive it indeed into the root canal, we take it out, we dive it into the fluorophores, and then we can use the reveal technology to identify and to see the 2 different colors. We understand then, did we manage to disinfect, or do we still have to continue? And this is basically, ladies and gentlemen, where I want to see it mostly used in endodontics, because we take out, we eradicate guesswork. Again, sensitivity, specificity, I do not know. Yes, I know the importance, but I believe this is where we have, this is what we owe our patients, you know, not to give the arrogance of that white line of the X-ray, but to tell them, look, the chemical disinfection has been successful now. These tools may be restored and can be used in the future. So this is my application. These are my 2 visions for applications in endodontology. Thank you.
I've got another question to you. Because detection is color sensitive, how do you see this in professionals that suffer from daltonism, color blindness? Would that work? How do you think?
Probably not. This is something which, sadly, the problem is green-red, and this is exactly the area which is affected. And I'm very sad to give a negative answer. They will not benefit from this technology.
Maybe, again, maybe fluorophores changing the color coding could give some hints, at least of brightness. This is something we could look into. What do you think?
Of course, danke. Of course, there are ways to address this, but according to my experience, currently experience, trying to apply, to involve those companies generating and producing those fluorophores, I am very negative about it. I'm not very optimistic in that area.
Max, I think considering the time, it should be okay then.
Okay, we planned for a 1-hour activity. I'd like to make clear that it's still open for questions. All the professors, we had more than 50 professors from different parts of Brazil watching. We are very happy with that. And thank you very much again for Dr. Levi Steyer. We are really looking forward to know more about this topic in the Congress in Porto Alegre next year. We look forward to have you here again. And again, thank you very much for the design, for Vision and Optima for supporting this activity. And also thank you very much for Dr. Marco Ungaro. Your participation is very special for us as the president of the Brazilian Society of Endodontology. And also Professor Figueiredo for supporting us with questions and mediation this activity. I'm quite sure the topic is not finished. We have a lot to talk about this in the near future, and wish you all keep safe and healthy with your families, taking care of yourselves, and thank you so much.
One more issue, please. If anyone wants to contact me, please, you feel free to contact me via email. My email address is lsteier, so lsteier@gmail.com. I'm very happy to get in contact with you personally. Thank you once again very, very much. Oh, thank you for putting that in, yes. Thank you very much. And it was a very great pleasure. I was delighted, honored to be allowed to lecture in front of you. Thank you very much and have a great day and stay healthy, please.
Thank you.
Thank you, Livio. All the best to you and your family.
Thank you.
Thanks, Designs for Visions, John Walsh especially, and Catherine, thank you very much.
Thank you.
Bye-bye. Thank you.
Bye. Bye. Thank you. Bye.